This is a guy. He just found out about the theme for the third International Conference on Family Planning. What is this theme, you ask? Full access, full choice. He begins to ponder this theme. What does this theme mean to him? What does it mean to his family, the woman in his life, his sister, mother, aunt? He decides to break down the theme into its components. He thinks to himself, what comes to mind when I think about the word full? Complete, entire, total. What about the word access? Entry, permission. And the most important word, choice. Definitely options. Options are great. Options enrich our lives. Having options empowers people to take charge of their own lives. It gives people freedom. Throughout history, freedom is something that people fought and died for. We talk so much about fighting for our lives, but what does it mean in essence? Let us look at the various aspects of our lives. Social life, financial life, religious life, family, reproductive, and sexual life. Let us focus our attention on reproductive and sexual health. This to me is the big issue. With regards to reproductive and sexual health, does everyone have options? Does everyone have access? Truth be told, the answer is no. What is the problem, you may ask? Simple. There exists a disparity in the access to reproductive health options for families, especially females, whether a teenage girl or an adult woman. For instance, disparity can be said to exist when a woman dies from a preventable reproductive problem in a developing country. Reproductive health revolves around adequate access to sexual and reproductive health services and rights. Access is essential to the prevention of the negative reproductive consequences, such as abortion, fetal and maternal death, contraception, vaccines, example HPV vaccine, sexually transmitted diseases, HIV/AIDS. We need to eliminate these disparities which hamper our reproductive lives. Again, we need options, whether contraceptive options, condoms, contraceptive pills, diaphragm, maternal health care options, hospitals, obstetricians, pediatricians, reproductive education options, pamphlets, presentations at health clinics, etc. From the above listed options, it is clear that our answer to the reproductive disparity problems lie in the fact that women of reproductive age need to be given options. What is family planning, you may ask? Essentially, controlling reproduction. Family planning refers to the practice of controlling the number of children in a family and the intervals between their births. Essentially, how many babies a family unit wants and is able to support. Planning here connotes choice again. Families need to be able to exercise control over their reproductive functions. Although they have the right to a family, they also have a responsibility to the members of that family to ensure that they can adequately take care of the family unit. Family planning also gives the effective use of contraceptive techniques, be it a condom, sterilization, etc. These techniques go back to the fact that adult men and women have choices when it comes to their reproductive health. Again, having access to these methods of family planning is essential, as sexually active couples through effective family planning can avoid some of the negative consequences which can arise as a result of ineffective use of some of these methods, such as unwanted pregnancies, sexually transmitted diseases. How do I propose that women learn and, most importantly, embrace their options? Through youth advocacy, of course. Advocacy is essential to ensure that we achieve our reproductive goals. We need to eliminate these disparities which hamper our reproductive lives. Advocacy is essential to ensure that we achieve this goal. More so, youth advocacy is essential. This was prepared by Nicole Nation. Thank you.